The extensor hallucis longus is one of the four muscles in the anterior compartment of the leg. This muscle, as its name implies, goes to the big toe, hallucis means big toe, and it extends the big toe at the metatarsophalangeal and interphalangeal joints. To engage this muscle, we need to ask the client to extend the big toe and to isolate this action as best possible, to not extend the other toes and to not dorsiflex the foot at the ankle joint. There's the client extending the big toe. We can add resistance to this. It is often helpful to have the client first show us the action that he is going to do, so when the palpation is done, it will be done cleanly. So now that the client extends the big toe against resistance, we see the distal tendon pop out visually. We can then follow this distal tendon proximally. To have an idea of what tendons are in the region, we can ask the client to dorsiflex the foot against resistance to make these tendons pop. This here is the tendon of the tibialis anterior. This is the tendon of the extensor digitorum longus and fibularis tertius. And here is the tendon of the extensor hallucis longus between the other two. We can now continue palpating the extensor hallucis longus proximally as the client alternately contracts and relaxes it. As we go further proximal in the leg, we get to a point where the extensor hallucis longus goes deep to the tibialis anterior and extensor digitorum longus. Unlike usual palpations where we press in deeper for a deeper muscle, here I recommend that we press lighter. It can be helpful to close our eyes and gently feel for the vibrations of the extensor hallucis longus contraction deeper in the tissue. I do not recommend strumming perpendicularly across the muscle here. Just feel for the contraction and then follow it proximally as far as possible in baby steps. Now, if we go off course with the palpation, it's always possible to adjust the location. Just go back to the last place where we successfully felt it and then re-begin palpating it from there, following the path that the muscle takes. As we continue palpating the extensor hallucis longus proximally, right about here we'll usually lose the ability to palpate it, which is appropriate because this is the most proximal extent of the attachment of the muscle. This muscle attaches to the middle 1/3 of the anterior fibula, right in this region here, and it goes down distally into the foot where it becomes tendon and then goes to the middle and distal phalanges of the big toe.